more than genes link magnesium and type 2 diabetes. Magnesium is an important nutrient, in part because it appears to help regulate insulin secretion and/or action. Sure enough, studies over the last decade have shown that low intake of the mineral is a risk factor for developing type 2 diabetes. But everyone is different, so doctors need to know much more before they can accurately tailor nutritional therapy for patients. A new study in the Journal of Nutrition finds several deep, specific interactions of diet, genetics, and ethnicity in determining magnesium-mediated diabetes risk in postmenopausal women. It's not informative enough to examine disease risk in terms of just genes, or just magnesium intake, says study senior author Simon Liu, professor of epidemiology in the School of Public Health at Brown University and professor of medicine at the Albert Medical School. The ultimate effect of a genetic mutation on a disease outcome is indeed dependent on environmental exposures, Liu says. It is an interaction in the genetic code. To better understand those interactions in the relatively understudied populations of Black and Hispanic women, Liu's team looked into the rich dataset of the Women's Health Initiative, a massive study funded by the National Heart, Lung and Blood Institute. With this resource they were able to analyze the magnesium intake, type 2 diabetes status, and genes of 7,287 Black women and 3,285 Hispanic women between the ages of 50 and 79. The study aimed to account for all genes known to regulate how the body handles magnesium. In all, the team looked at 17 genes and in particular at 583 common one-letter differences in their genetic code, e.g., what would normally be an A is instead a G. These differences are called single nucleotide polymorphisms, SNPs. For example, lead author by K. Hang, Katie Chan and her co-authors found that among Hispanic American women with high magnesium intake, those with the SNP RS 8,028,189 on the gene, and IPA2, had a 35% lower type 2 diabetes risk than women overall, an uncommonly high advantage. Black women, meanwhile, showed a 16% lower risk for each copy of the gene, CNNM1, they carried with the SNP RS 6,584,273. Here, however, there was no clear dependence on how much magnesium they consumed. The study provides clues into underlying physiological connections that link magnesium to diabetes. Nutrient metabolism is genetically regulated and each gene typically has some specific functions, Liu says. And our study suggests each one's relative contribution to diabetes risk in different women. But more study is needed to understand these links well enough to craft interventions. Personalized prevention. Liu's team plans further studies into the links among diet, genetics, ethnicity, and the risks of diabetes and cardiovascular disease. Ultimately, he hopes to make findings that enable highly personalized prevention and medical care of the conditions, informed by an understanding of the complex interplay between lifestyle and biology in each patient. That's the general framework of 4P medicine: predictive, preventive, personalized, and participatory, he says. We are not ready for prime time yet, but that's ultimately the goal. Support for the research came from sources that include the National Institutes of Health and the Burroughs Wellcome Fund. Source: Brown University. Republished from Futurity.org. under Creative Commons License 3.0. Asterisk image of pills, via Shutterstock. Next read Trump administration sanctions Russia for election interference and cyberattacks. The Trump administration sanctioned 19 Russians and 5 Russian entities on Thursday, March 15, for attempted election interference, cyberattacks, and intrusions into critical infrastructure. The Department of the Treasury will block the property. Read more. A growing chorus objects to Confucius Institutes at American universities. A Massachusetts lawmaker is the latest dissenting voice against the presence of Confucius Institutes on American college campuses. Managed directly and funded by the Chinese regime, Confucius Institutes, CIS, have been criticized by concerned. Read more. Tariffs, Trump's prelude to ending unfair trade practices. President Donald Trump's new tariffs on imported steel and aluminum look like an effort that goes beyond its stated rationale of preserving national security. Tariffs could be the first of a number of. Read more.